welcome.
Good morning.
Thank you very much for coming this morning. If you'd like to take a moment to introduce yourself and then make an opening statement, that would be lovely, and then we'll open to questions. Thank you.
Yes, good morning. QNU thanks the Health and Ambulance Services Committee for providing time for us to present here today. My name is Beth Mohle and I'm Secretary of the Queensland Nurses Union, and with me today is James Gilbert, our Health and Safety Officer, and Dr Liz Todhunter, our Research and Policy Officer. So we will take our submission as read, but we'll just like to make some opening remarks. The QNU recognises the importance of immunisation as a public health initiative that saves lives. Immunisation not only protects individuals but also others in the community by reducing the spread of disease. Other than clean water, vaccinations had the most significant impact on public health during the 20th century and remains one of the most important activities involving health professionals. For these reasons, the QNU gives support to the bill. In many ways, immunisation programs have become the victims of their own success. In industrialised countries, the vast majority of the population has never witnessed the diseases that vaccines protect. Consequently, in recent times, there has been a growing resistance to such interventions. However, we know that routine childhood immunisations protect babies and children against potentially serious diseases such as measles, polio, tetanus and whooping cough. When high percentages of people are fully immunised, diseases such as whooping cough have a less opportunity to spread because there are fewer people who can be infected. We recognise that there are parents or carers who choose not to vaccinate their children for various reasons that may be around vaccine safety or preference for natural immunity. Parents or carers who refuse vaccination during infancy and early childhood may consent to vaccination after the child reaches school age. Unfortunately, children whose vaccinations are perpetually delayed or refused present a health risk to other children at school. Some parents with vaccination safety concerns may also express a strong distrust of government and vaccine manufacturers and, by extension, a distrust of conventional preventative medicine. We know that giving childcare providers the option of excluding unvaccinated children from care may be confronting and contentious. Of course, children have an internationally recognised right to education. Children also, under Article 22 of the Conventions of the Right of the Child, have the right to good quality health care. We argue that these two rights are not mutually exclusive and work together to promote the best possible future for all children. Therefore, although we accept that parents have the right to make personal choices about immunisation, in choosing not to vaccinate, they may place others at risk. For these reasons, we support initiatives that will protect the public from any outbreak of a vaccine-preventable disease. We have not addressed the second part of the bill regarding the proposed changes to the Health Ombudsman Act. We understand that Labor is committed to a review of the Office of Health Ombudsman, and we would like to hand up our original submission regarding the establishment of that office to the committee. It may assist in your deliberations, so we have that submission here today.
Thank you. Thank you for those opening comments. Just to touch on your submission and again your comment then, what options do you see as being the best ones to engage with parents who do have deeply held concerns about vaccinations?
I think that it's really important that we do take a step back and give some careful thought to this, because I think people need to have their concerns heard. I think that there's often, of course, competing interests here, and there's very deeply held views, as we know, but I think we could look at strategies whereby we do establish mechanisms for parents to have their concerns heard and felt that they have been heard. So I think that there certainly are issues in regards to, say, for example, new vaccine regimes that may not be the tried and tested ones, and parents might have concerns about the efficacy of those. I think that it doesn't do anybody any good just to stand back and say, we're not going to engage with you about that. I think it is challenging, but we have to put our mind to how we provide avenues for engagement to occur and for concerns to be heard and for the evidence to be provided and for the evidence to be tested if that is required. So it is challenging. We absolutely do know that is challenging. We do support the initiative that Dr Young highlighted about the Lady Salento Hospital and what has been established there. But I think that there's a much greater need for community engagement and education about this.
Thank you. Deputy Chair.
Thank you. Hello, Beth. How are you?
Hello.
I just raised before with Dr. Young about, again, that childcare workers not being vaccinated, and we all know that disease spreads in lots of different ways. It's not just from child to child or from health worker to child. You and I both know that health professionals can inadvertently spread nosocomial infections in hospitals. So has the QNU got some process around ensuring that the nursing staff have their vaccinations up to date as well? I mean, if we're going to do herd immunity with everybody and try and eradicate as many of these diseases, we have to look at all different aspects.
Our policy committee gave some considerable attention to the whole issue of vaccination just the year before last, wasn't it? That we and we've endorsed our federal body's policy in regard to vaccination, which I think we have provided as an attachment to our submission. It is an ongoing challenge, and we certainly do promote it to our members to make sure that they keep their immunisations up to date. I might hand over to James in terms of he can provide some background in terms of what happens at the hospital and health service level and how we engage with Queensland Health in relation to that.
Great, thank you.
To date, it hasn't really come to a head, so to speak. But we're not in the business of telling people that they should be vaccinated. We advocate that they should be, but ultimately it's their decision. And then we would, if the employer, say it was Queensland Health, said, well, this area we believe that there's a risk to not only yourself but to the people that are utilising the service, we would need to consider whether you can continue to work here unless you're vaccinated. We would engage in looking at possible reasonable adjustment for those people to continue their employment, but ultimately it probably comes down to the employer's determination. I do know there is a committee meeting at the moment in regard to health worker vaccination within Queensland Health, because currently the only vaccinations that are mandated as employment is Hep B, and in terms of, I've got the policy from the School of Nursing and Midwifery at University of Queensland, and it follows suit. It essentially says they recommend that people are vaccinated for all of the vaccinations under the immunisation handbook for categories of workers, essentially, but the only ones that it is mandated for is Hep B.
Do you aware of any screening programs for nursing staff who work in paediatrics or midwifery where they're likely to have to deal with these infections? Or
we don't, because we're not the employer.
No, I know, but we're not.
Yeah, look.
Has there been any thought to it? Because they're the ones most likely to be dealing with unvaccinated children or outbreaks of diseases.
I'm not au fait with what happens in terms of. You'd probably have to ask Queensland Health. Or you'd have to ask the private employers as well. They have paediatric wards as well. So I'm unsure of what they're... I'd imagine that they'd, without it being mandated, potentially people could say, well, I don't want it.
Yeah, I guess where I'm going with it is...
Yeah, I understand where you're going.
Both
absolutely. Look, as a health and safety background, at the last time we did this committee, my view was we look at health and safety people look at things in terms of the hierarchy of control. And clearly, if you're going to rely on PPE, that's not as good, not as an effective mechanism as vaccination. It's a much higher order control in terms of managing it. So, that's where we come from, essentially. And I'm sure that's the way an employer would look at it too. And I think at the last committee, I mentioned that I believe that childcare establishments have those obligations to the Work Health and Safety Act.
Okay, thank you.
Yeah.
Beth, is it your perception, just to come back to education, that you talked about how important education is, and that if I'm correct in recalling, more in education would be better than mandating? I mentioned earlier to Queensland Health, I have a 2 and a 4-year-old, and I found that there was extensive information and education, and it was mentioned by my GP and mentioned by the hospital and mentioned by the paediatrician. Is it your perception that there's not enough already?
It's not so much as education, it's about engagement, about getting to the source of what the concerns are. So it's a bit more nuanced than that. It's a bit of a deeper dive, if you like. It's actually getting to the source of what the concerns are and trying to unpack those and see whether there are ways of dealing with that. So I agree with you. There's a lot of information out there about the importance of basic public health education about the importance of immunisation, but I think that it would really be beneficial to take a bit of a deeper dive, if you like, and to engage with populations who express concern about that and try to get to the root cause of the concern and see whether it is possible at all to address, to breach the difference. It may not be possible, but I think it's worth that effort into the engagement to do that.
And who do you feel is best placed to do that engagement?
Well, I think that Queensland Health has a role to play, certainly, in that regard, and the various hospital and health services, now that it's decentralised, could do that through their population health work and their general engagement with the community. It might be more of an issue at some hospital and health services than at others. We are aware that there are particular areas, geographical areas where it's more pronounced, so it might be a higher priority for those hospital and health services to look at engagement in relation to that and to actually, as I said, trying to unpack the source of the concern and to see whether there are strategies that could deal with that.
Thank you. Member for Greenslopes.
Thank you, Chair, and good morning, Beth and James and Dr. Todhunter. Good to see you again. In relation to a range of public health strategies, there's always positive and negative approaches to getting compliance, and you never get 100% compliance in something like cigarette smoking or drink driving or the wearing of seatbelts. There's always an approach for public education matched with fines for people who don't comply with the education that's provided to them. Similarly, there's been some criticisms of this bill that this has got some coercive issues there. Your submission talks about the need for the government to allocate more resources for community engagement and education, but do you also think that, just as with other public health initiatives, we need to also encourage people to behave in a manner that's going to be of benefit to the entire population?
Mr. Kelly, that's exactly our point, is the fact that you can't just rely on coercion. It really does need to be about engagement and as I said, trying to get to the source of what the concern is. You get much more if you take the time to sit down and unpack the various interests that are at play here, because there are at times competing interests. And that's hard work. I mean, that's not easy. We've had a lot of experience at doing that as a union. In our approach to industrial relations, for example, that's the approach that we prefer to take. It often takes a longer time to do it that way, but we find that it generally leads to better outcomes because there's a better understanding of each other's perspective and people actually hear what the concerns are if we take the time. So coercion will only go so far, and there'll be a backlash in regards to a strictly coercive approach to anything, has been our experience.
Thank you. Member for Buderim.
Beth, thank you for coming along today, and also your colleagues. By the sound of your opening statement, you are reasonably supportive of immuning the herd out there so that we don't become contagious and spread this throughout our community. I'm just wondering if the Nurses Union, they're reasonably well heeled and they've got a very good advertising campaign, which I've seen from both sides. Would the union be willing to assist in advertising and communicating to their members and also the general population about what a good idea it would be to immunise our young children, and have they done that in the past, and is there plans to do that in the future?
We certainly do promote that to our members, and certainly through a health and safety yearbook. On an annual basis, we provide to our members a health and safety yearbook that has various each year we have a different theme for the health and safety yearbook, and in the past we have covered off on immunisation and those sorts of things. We certainly look at continuing to do that, but we do on a regular basis promote that, particularly in relation to our policies. The policies, and I highlighted out the policy from the Australian Nursing and Midwifery Federation that we've endorsed in regards to vaccination. So we certainly would be willing to promote that to our members, but the extent of our responsibility to do that for the broader community, I would question it is our focus is on our members and communicating to our members about what is important, and from their perspective they would have a different perspective, as James highlighted, as an employee too as well. I mean, more often than not, the main arguments that we have about vaccination when they occur is about whether the employer is prepared to pay for it too. That's the contentious issue, is that there's an expectation that workers pay for it rather than employers. So more than happy to promote it to our members and to do anything positive that we can through social media and the like to promote it more broadly as well.
Just a suggestion, and I know I say this tongue-in-cheek to a point, but I mean, what a great idea it would be if the union could use the same potential that there's in election campaigns out there promoting this issue. I think it'd be a really great exercise, and I would support it bipartisanly.
Oh, and that's that is just about what our priorities are from a policy perspective, isn't it? Because there's only so much airspace out there in terms of, and our objective is always to get our main point across in terms of what we're prosecuting in election campains. But certainly take the point that we have a role to engage with the community. We take that very seriously, and indeed the Queensland Nurses Union was the organisation, along with the then Queensland Nursing Council, that formulated a social charter for nursing and midwifery in Queensland, which was very much about that engagement with the community and about forming a partnership with the community to improve health and well-being of the whole community. So we do take that obligation seriously.
Thank you very much.
Thank you. Member for Thorngower.
Good morning, Beth, and your fellow and well-esteemed people in this area, I'm sure, from QNU. It's good to have your contribution on this particular topic. I'll take your point about the education. More can be done in that space. But in your submission, it called for robust independent evaluation of the evidence around vaccine efficacy and the ongoing process to enable proper consideration of the new evidence. And perhaps Dr. Jeanette Young and the previous Department of Health people could answer this question. I'm particularly interested in your thoughts that you have on the independent mechanism to evaluate the vaccine efficacy, as Dr. Jeanette Young and the Queensland Health people did take Member for Greenslope's question on notice. They'll actually provide some good data around allergic reactions and all the rest of it. Can you expand on any of that before they are mandated?
I think that is indeed the critical point here, is the fact that we can't necessarily rely on the fact that people necessarily understand that information about efficacy, and it's forever changing. More evidence is every day coming forward. So we have to have a strategy to update the evidence, if you like, and put that before the community. And that's really critical, and I think that Dr. Young's area has got a really important role to play in that regard. It's particularly important when we've got new vaccines that come along too as well. I mean, we just really do need to make sure we have got very rigorous processes within Australia to actually ensure the safety and efficacy of vaccines, but I think that everything that we do, as a union, we're very much evidence-based. So everything that we do should be founded on a very firm evidence base, and communicating that to the community can at times be a challenge, but we've got to get better at communicating. And as Mr. Kelly said before, it's a really good way to actually look at it in terms of the evidence that he asked the Chief Health Officers to provide would be very useful to put that before the community in terms of the trade-off, if you like, in terms of the evidence. We have to get better at finding ways of engaging with the community on the evidence, but never taking for granted the evidence doesn't stand still. There's always new evidence that comes about, and how do we continue to integrate that into our communications about public health issues?
Thank you. So you would, in terms of the independent evaluation, would you accept the Department of Health's data when they do get...
Department of Health can source data from a lot of different sources, yes, absolutely, and from the federal government as well. So, yeah.
Thank you very much.
Thanks very much, Beth, and to your colleagues as well for attending today. We know there are a number of rural and remote workforce challenges across Queensland, and we do have, in some of our remote parts of Queensland, rural isolated practice endorsed registered nurses.
RIPERNs.
The RIPERNs. So my question really is, should nurse practitioners, or should those roles be upgraded to full nurse practitioner roles, and immunisations be within the scope of independent nurse practitioners? And if so, should those roles be funded across Queensland or in specific areas in your view?
Yeah, I think that there's Dr. Ryan, I think that there's probably, they wouldn't necessarily have to be at nurse practitioner level. We have argued for some time to successive governments that the RIPERNs are underutilised as a role, and that there should be a strategy to upgrade them to nurse practitioner level to service remote communities. But in relation to immunisation, there are other roles in terms of immunisation. Nurses in city areas actually perform that function. So I think that there's really great opportunity to look at the roles right now in terms of what's available, and we're coming up to our next enterprise bargaining negotiations, where we'll be looking at career and classification structures. And one new role that we've got under the current government is a nurse navigator role that is working across the continuum of care. That could certainly, they're not necessarily giving the immunisations as such, but part of that role could certainly to be looking at issues like how we increase immunisation rates across the population. So I think that there is a great potential to look at new roles. I don't think it necessarily would necessitate an expansion of the scope of practice, because I think it's currently within scope of practice. So I don't think you'd necessarily have to go to nurse practitioner level to do that. But I totally agree with you that RIPERNs are an underutilised, very precious resource in rural and remote communities, and we should be looking at ways to decrease the barriers to them utilising their full scope of practice.
So is it the union's view as well that I guess the nurse navigator role might sort of morph into more independent nurse practitioners in the hospital system?
No, and again, that's not necessarily the role there. I mean, a nurse practitioner may be a nurse navigator, but that is not necessarily the case. The way that we see the nurse navigator role happening is they've got a critical role to play in ensuring better coordination of care across the care continuum. We think that patient-centred care really effectively in our current system is paid lip service to. We talk about it, but we don't really do much to bring effect to it. And we think all health professionals have a role to perform to ensure better coordination of care and to ensure that the patient is genuinely put at the centre of health and aged care decision making. We think that the nurse navigator role is an important potential game changer in that regard, to work across the whole continuum, acute, primary health care and aged care. We are really pleased that we've got this initiative from the state government. We are keen to see it extended to the federal government to buy into that, and we've actually made that submission to the federal government's review of primary health care, that we think that we need a game changer. We absolutely do, because it's better for patients, but it's also better for the sustainability of the healthcare system. And so we really absolutely welcome this initiative as a start, but we think much more can be done, and we need to build upon that, which is why we'll be lobbying for that in the upcoming federal election as well.
My final question is, should nurses in all Queensland public hospitals be required to be vaccinated to ensure patient safety and reduce infectious diseases in the community?
The position of the ANMF in the position statement that we attached was the fact that we believe that they should be immunised, but it's a careful balancing, as James said, in terms of people who hold closely held, really deeply held conscientious objection. We need to work through that. So the broad policy position is that we believe that yes, that they should, and we would work with members who do have concerns about that.
Thank you.
Beth, James and Dr. Todhunter, thank you very much for appearing this morning, and thank you for your ongoing involvement in the inquiries of this committee.
And we'll hand this one up, this submission. So
yep, thank you.
Terrific.